you're going to do is come on all fours. You're going to cross the front leg or the right leg in front of your left leg, and then extend your left leg back, and you should feel a stretch down the back of your hip. I like to keep the chest up, like so. So you're going to reach your collarbones up. You don't want to be here all rounded and collapsed. You want to come up, like so. Keep your spine nice and straight. Let your hips be nice and heavy, and they will sink down into the stretch you'll feel on the right side. You might also feel a little bit of stretch on the front of the left leg through the quadriceps and hip flexors. That's fine and totally normal. You will tend to have one side that's much tighter in the back and one side that's much tighter in the front. So each time you breathe in, take a nice deep breath in, breathe out, and sink a little bit lower into the stretch. Think about bringing your breath into the area that is tight, into the area that's a little bit sore as you're sitting here and stretching. And sink a little bit lower. Okay, we're going to switch sides, so go ahead and come back up onto all fours. Now we're going to bring the left leg in front and extend the right leg back. Again, make sure you keep your chest up nice and high. Watch that you're not rounded here. Chest up high, eyes straight ahead. Don't look down, don't crane your neck up. Just keep it in a nice neutral position. And gently sink into the stretch. Now this is a little bit advanced if you have full-blown sciatic nerve pain, so you want to do a different variation of this stretch. Because right now you've basically got your body weight sitting on top of your hips and sitting on top of your lateral rotators. And it's putting quite a bit of pressure, which is great. That's what we want because we're overriding the stretch reflex, which is what you feel when you hit the point of tension in your muscles. It's actually a neurological set point. It's not that your muscle is too short, it's that your nervous system is sending a signal saying, oh, we're not used to going that far, we're not sure that's safe. But if you have actual inflammation in the sciatic nerve to a great extent, this is going to be too much for you, so back way off. If you just have some soreness in the back of your leg and hips, if you have soreness in your SI joint, or actually if you get soreness in your low back at all, this is an excellent stretch. Tight muscles in the hips are definitely a primary cause of low back pain. There we go. Feel that release. And we're going to come out of that. And then I like to finish this stretch off with just a nice child's pose. And just to let my body relax and breathe into the length that I've gotten. And just take a couple breaths here. And there you go.